Previously, we discussed the fact that you can control the uh, flow of GFR using either autoregulation, which basically means your kidneys are going to self-regulate, or if the change is significant enough, then your body is going to rely on extrinsic factor, which would be your central nervous system and your endocrine system. We also went into talking about the intrinsic control or autoregulation. We said it's broken down to two mechanisms. The first mechanism was discussed in the previous PowerPoint and was referred to as myogenic mechanism of autoregulation, where you basically look at the flow of the pressure of filtration, and based on that, you either increase or decrease the diameter of the afferent arteriole to increase the pressure. So just kind of quickly reviewing that, if your pressure in the afferent arteriole is low, it means your rate of filtration is low, and the way your body reacts to that is cause the vasodilation of the afferent arteriole, which basically means it makes the afferent arteriole larger, and therefore more blood will come into the glomerulus, and more blood means a higher pressure, so your filtration pressure increases, and therefore your rate of filtration also increases. Again, this is referred to as myogenic mechanism because you are relying on the muscles to make the adjustment to control the blood pressure. Now, the second mechanism of autoregulation is it still happens within the kidney. So you're relying on the kidney to basically self-control its GFP as well as GFR. So let's take a look at this. So in this scenario, we have a low afferent arteriole pressure. So afferent arterial pressure has dropped lower than 55 millimeter of mercury. Now again, recall that if your arterial pressure is low, it means the glomerular filtration pressure is lower, which means the rate of filtration drops. Now, when your filtration rate drops, it means the flow of the fluid within the renal tubules is going to decrease. So as fluid is passing through the PCT, descending and ascending limb, and DCT, the fluid is slowing down. That means that those molecules within your filtrate will have more time to be reabsorbed back into your bloodstream. So it says more NaCl is going to reabsorb back into your bloodstream compared to what your body actually requires. So when your body notices it as it passing through the DCT, your body notices that you're reabsorbing a lot more material that you need. So what is its solution? It's going to again dilate the afferent arteriole, and dilation of the afferent arteriole increases the GFP, and GFP, as pressure increases, the rate of filtration also increases. Now, as the rate increases, that means fluid is going to move more rapidly through the renal tubules, and as a result, it will not get as much a chance to reabsorb as much salt and other molecules in its path. Therefore, as I mentioned, filtrate speeds up, which means less sodium and chloride going to be reabsorbed back into your bloodstream, and you have basically controlled and maintained your rate of filtration. Now, this mechanism is relying on both the glomerulus to identify that the cells around the afferent arteriole, as well as the movement of fluid through the renal tubules to determine if the GFR needs to be increased or decreased. Because of that, we use the terminology tubulo-glomerular mechanism of autoregulation. Yes, same thing could be applied if your GFR is too high, which means basically you're not reabsorbing as much salt as your body requires. So your solution would be to decrease, or I should say, constrict the afferent arteriole, which leads to a slower or a lower GFP and lower GFP means lower GFR. Fluid slows down, and as a result, you will have more time to reabsorb those material. Here is the two processes that I already described to you, but just kind of visualizing the concept. So you have drop in blood pressure, which also means drop in GFR. That causes a stretching of the smooth muscle, decreasing the stretching of the smooth muscle in the afferent arterial wall, which implies that this is going to be vasodilation. Vasodilation means an increase in filtration rate, and that means that you're basically increasing the speed of fluid passing through your renal tubules. The second option is you have a low GFR. Lower GFR means your fluid is going to slow down, which means more salt is going to be reabsorbed. The cells, that's what I was looking for too. I wanted to make sure that you guys know it. The cells that are going to understand that are called the macula densa. We learned about it in the first PowerPoint. And their job is to cause a opening of the blood vessels or vasodilation of the afferent arteriole, which eventually leads to, again, increase in GFR, and that means that your your salt will not be absorbed as much. Do understand that the two systems we have discussed so far are systems of intrinsic mechanism, which means your blood pressure is somewhere, it's relatively or manageable. So you're not really directly going to go to your nervous system and your endocrine system immediately. You try to resolve the issue yourself, hence the kidney and autoregulation. However, as it mentioned here, if the pressure is significantly changed, then your body is not going to, your kidneys will not be able to do it on its own. Therefore, you need to rely on your endocrine and your nervous system to do that. And this is really important for you guys to feel confident with this information, because there would be a lot of questions either directly asking you about the pathway or questions that basically ask you to describe the steps within this pathway. So let's discuss the extrinsic control system. So when you hear the word extrinsic implies outside, right? So in our body, our extrinsic control are either nervous system or your endocrine system. So sympathetic nervous system, which we learn about them in the cases of your cardiovascular system, is also known as fight or flight response. It's going to be activated when there is a severe decline or increase in your blood pressure. So we usually describe the decline in your blood pressure because that's a more common scenario that you see, because filtration rate can be adjusted to make sure your body doesn't retain too much water. So in this scenario, let's say you have a severe drop in your extracellular fluid or your ECF. So basically a severe cases of dehydration. And that causes, if you don't have enough fluid, that means your systemic blood pressure will be dropped. So your normal blood pressure would be about 120, but if it drops below 80 millimeter of mercury, then your body needs to find ways to basically reserve the water and limit how much water is going to be lost through urine. So one of the mechanisms that it does is through the output and introduction of norepinephrine and epinephrine into your bloodstream. So these are both hormones or neurohormones that will be having an effect on your smooth muscles throughout your body. So basically, it's going to cause the muscle contractions around your blood vessels, making them smaller. And that causes a basically maintaining of your blood pressure. And also, you don't have that much fluid anymore, right? So do you want that fluid to be lost through the urinary system? And the answer is no. So the way your body is going to handle it is going to make the afferent arteriole smaller. If your afferent arteriole is constricted, it means less fluid is going to flow into your kidneys and therefore less filtration and as a result less urine production. Now both of these eventually is going to have an effect on your GFR. Again, your urine volume is going to significantly decline. But the main goal of this process is to reestablish your blood pressure, because this whole thing started because there was a significant drop in your blood pressure. So let's say a person that has got into a car accident and they have lost a significant amount of blood. One of the things that you notice in these patients is that there is a severe decline in their systolic blood pressure. So your body way of defending it in the sense of your nervous system is one to constrict all of the blood vessels throughout your body to make sure that your blood pressure is maintained. Basically, if you have a big tube, your pressure is low, but if you have a smaller tube, you can maintain the pressure even if the fluid is less. And also the other factor is that you are going to constrict your afferent arteriole, while through that you are going to limit how much fluid is going to be released into the nephron tubules, declining or decreasing your rate of filtration and therefore your urine production. Now, the second system we're going to discuss here is the hormonal system, which is heavily relying on multiple structures in your body, including your hypothalamus, which is part of your endocrine system, as well as the adrenal gland and your kidneys and as well as your lungs. So this is a relatively complex system. So let's just walk through this process, and then we'll continue in the next presentation going into a little more detail. So remember the whole homeostatic feedback loop that we learned? We had components within them. So the components we learned was a stimulus, sensor integrator, which basically notices the change. A stimulus is the change itself. Output is what your sensor or your integrator is going to produce, and it's going to have a specific targets in your body. So it's not just going to go randomly and affect every part of your body. It's going to have a very certain or specific destination. Now, when that hormone has reached its destination, it's going to cause a certain change or effects throughout your body with the goal of reestablishing your homeostasis. So in this case, our goal is to basically, the stimulus that triggers this whole system is there is a significant drop in your blood volume. And remember, if your blood volume declines, that means your blood pressure also going to decrease. Now, if your blood pressure is low, as we learned before, that means your GFR, filtration rate, is also going to decline, and there is going to be a decrease in the sodium by the time it reaches where? Your DCT, because your body has reabsorbed a lot of that sodium back into your system because the fluid is moving so slowly, as we discussed earlier. Now, this is going to trigger these low levels of sodium in your bloodstream, in your DCT, is going to trigger a system in your called this change is going to be noticed by specific sensors, which is part of the juxtaglomerular complex, which is within the nephron. And I do have a picture of this to just kind of show you. Juxtaglomerular complex is what we have right here. So this is your afferent arteriole, this is your DCT, and this is the efferent arteriole leaving your nephron. Now, as we go through this, your kidneys notice, or your nephrons are noticing that there is a change in the environment, and as a result, they trigger a release of a protein known as renin. Now, renin is going to target a protein that is found inside the blood, inside blood plasma, I should say. And this protein is referred to as angiotensinogen. Angiotensinogen, as it says on the next slide, is an inactive protein. It's an inactive enzyme, which means it's really not doing anything until it interacts with renin. So, angiotensinogen in the blood interacts with renin, and as a result, it becomes what? Angiotensin 1, which is basically partially becoming active. Now, angiotensin 1 is not done. It can't do its job fully. So what it needs to go to your lungs, and at the lungs is going to be converted from angiotensin 1 to what? To angiotensin 2. Angiotensin 2 is the component that's going to carry some functions. So what are the targets of the angiotensin 2? One of the main targets, which is a really important aspect of this lecture, is adrenal gland. Adrenal glands are two pyramid-like structures that sit on top of your kidney. And what do they release? Aldosterone. You also have angiotensin to target your blood vessels, and it also targets part of your central nervous system. And you want to write this would be your hypothalamus, so you guys have an idea what that is. So I'm going to repeat this one more time. Your volume of the blood has declined or decreased, and as a result your blood pressure has significantly dropped. Again, scenarios is being in a car accident. That decreases the rate of filtration, which makes your body reabsorb more salt, and that sends a trigger to your juxtaglomerular complex to start to release renin. Renin goes into your blood and targets your angiotensinogen, which is an inactive protein within your plasma, and breaks down angiotensin inactive to angiotensin 1. Angiotensin 1 travels to your lungs and gets farther cleaved to become angiotensin 2. And angiotensin 2 has its own three targets. One is the adrenal glands, the glands on the top of your kidney, and force these glands to release aldosterone, which is a hormone. It also targets your blood vessels and a part of your nervous system, which is known as hypothalamus, and it is a section within your brain. We'll continue this lecture about how these three targets are going to be affected in the next presentation.